Heart and coronary heart disease. Heart structure. The primary function of the heart is to pump oxygenated blood to body cells from lung and pump the oxygenated blood back to lung. The heart maintains blood circulation by beating regularly. This beating is controlled by electrical signals inside the heart that trigger the contraction and relaxations of heart muscles. There are two circulation systems in our body: pulmonary circulation and systematic circulation. Pulmonary circulation consists of right ventricle, pulmonary artery, pulmonary vein, and left atrium. Systematic circulation consists of left ventricle, aorta, vena cava, and right atrium. There are two valves that connect these two circulations together. When the blood goes to the right ventricle from right atrium, blood needs to pass tricuspid valve. When the blood goes to the left ventricle from the left atrium, blood needs to pass the bicuspid valve. Valves are designed to prevent the backflow of the blood. The heart receives its own blood supply through the coronary arteries. What is coronary heart disease? Coronary heart disease is a common type of heart disease. It affects the main blood vessel that supply blood to the heart, including oxygen and glucose. The causes of the disease. The main cause of the coronary heart disease is a buildup of fatty deposits as aroma on the walls of arteries around the heart, coronary arteries. There are lots of factors that can increase the risk of developing fatty deposits. First is smoking. The main ingredient in cigarettes and smoke are both harmful: nicotine and carbon dioxide. They put a strain on the heart by tainting the vessel, both increasing the risk of blood clots. Diabetes can cause lining of blood vessel to be thicker, causing the block of blood flow. Long-term obesity will cause lots of fatty deposits to build up in arteries. High blood pressure can make the arteries hard and stiff. This can lead to atheroma. If the content of cholesterol is high, then it can also lead to coronary heart disease. Cholesterol is the fat made by the liver from saturated fat. It is essential to our body cells, but only in a limited range. If you have a large amount of cholesterol in your body, the risk of getting coronary heart disease increase. No exercise is also factors that can cause coronary heart disease. It is important to get regular exercise. Exercise helps manage weight, control blood pressure, diabetes, and cholesterol, and prevent fat accumulation. All are risk factors for coronary artery disease. For the diet part, the food that contain a large amount of sugar, saturated fat, or salt will increase the risk of getting coronary heart disease. That's all the risk we can control in our daily life. On the other hand, there are some factors that we can control. For example, the age. The risk of damage and narrow the arteries increase with the age increase. The gender will impact the probability of having coronary heart disease. Men are at greater risk of coronary heart disease generally. A family history of heart disease makes you more likely to get coronary heart disease because you may have a piece of DNA in your genes that makes you more likely to have that disease. Effects on body. If the artery is partially blocked, it can cause angina as pain. The patient will feel heaviness or tightness, usually in the center of chest. More serious partially blocked or completely blocked can cause heart attack, myocardial infarction. Heart attacks can permanently damage the cardiac muscle. Heart attacks can permanently damage the heart muscles, and if not treated straight away, can be fatal. When the heart is too weak to pump the blood to the whole body, it can cause fluid to build up the lungs, make the breath very hard. ECG. ECG is a way to diagnose coronary heart disease. The waves on the ECG diagram are labeled as P, QRS, and T, which represent different phases of the contract and relaxation. Depolarization is the process where the heart cells lose their charge, which leads to muscle contraction. The depolarization of atrium, represented by the P wave, and the depolarization of ventricles is represented by the QRS wave on the diagram. Repolarization is the process where the heart cells regain their charge, preparing for the next contractions. The repolarization of ventricles represented by the T wave on the ECG diagram. Thank you for watching.